When you look at our curriculum, there's 4 areas that really break out of emphasis. We have a management track where we prepare you on how to manage people, manage budgets, and look at the bigger picture of how healthcare administration works. We have an IT track. Because we're so integrated with electronic health record, our graduates have to know databases, data warehouses, data repositories, and how to do data mining and data analytics. The third track would be our medical science track. You will be taking anatomy and physiology, principles of diseases, where pharmacology is mixed in with that, and then 2 classes in medical coding, because you have to be able to talk to doctors, understand what they're saying, and translate that so what the insurance companies understand so that you can get sufficient reimbursement. And the 4th track is research. It's not uncommon for our graduates perhaps to go into a research center field, maybe a pharmaceutical research field. I've had graduates who were pharmacology representatives, drug reps. I've had them go to pharmaceutical research companies where they actually manage the protocols and the data that's collected in clinical trials. And so those 4 areas of emphasis all combined to give us a well-rounded HIM graduate. Their senior year or their 4th year in the program, they'll be going out and actually visiting different healthcare sites, whether it might be at a penitentiary or long-term care or the county health system, hospice, acute care, even the Veterans Administration Hospital, which is across the street from the University of St. Mary's. And then they'll also be working hand in hand with a mentor in a healthcare facility on a major project, what we call our senior project, where they will be developing a project that will be of use to that facility, working with a mentor, but also with a faculty member to ensure that it provides them the experience necessary to be able to, as soon as they graduate, walk right into a facility and start the job day one. So I've worked at other institutions of higher learning within the Kansas City metro area, but St. Mary's is a real value-based institution. And we take those values and we incorporate them into our curriculum. Without an ethical and value-based background, we have a tendency to lose why we're actually in healthcare to begin with. And one of the strengths of St. Mary's is that when you come on campus, you're surrounded with people who have the same values that you do and help support you. Also at St. Mary's, because it's a small school, you get to know everyone. You don't have 1,000 people in a chemistry class or a biology class, for example. We keep our class size small intentionally so you can have a personal relationship with the faculty and they can help nurture you to make sure that you are the best professional that you can possibly be.